Spina bifida. Definition: neural tube defect of the spinal column. Vertebrae fail to close completely around the spinal cord. Incidence and prevalence affects 166,000 persons in the United States in some form. Each year, about 1,500 babies are born with spina bifida, a major cause of paraplegia in children. The etiology: specific cause is unknown, but multiple factors, including genetic and environmental factors, are suspected. Folic acid supplements are taken during pregnancy can prevent this. Types: spina bifida oculata. Small defect in vertebrae not involving the spinal cord, often undetected. Meningocele, bony defect that allows meninges and cerebrospinal fluid, CSF, to form a sac that protrudes from the vertebral column. Meningomyelocele, severe defect in which spinal cord also protrudes in the sac. Signs, symptoms, and clinical manifestations. Potential exposure of the nervous system to the external environment results in an increased chance for further damage from trauma or infection. Loss of motor function in the lower half of the body. Differential involvement of muscle groups causes muscle imbalance, leading to spinal and limb deformities. Loss of sensation to pain, touch, and temperature. Creates safety hazards and pressure sores. Loss of bladder and bowel control. Ambulation may be affected, creating a need for orthopedic devices or a wheelchair. Deformity of the brain. Most have a normal intelligence but experience learning disabilities, especially visual perceptual problems. Some develop seizure disorders. In about 80 to 90% of spina bifida cases, there is a cyst with parts of the spinal cord and spinal wall present. This is called myelin meningocele. This type of spina bifida can happen in a relatively high or low position on one's back. It often causes problems with bladder and bowel functioning, and sometimes paralysis or limb weakness. CSF accumulates in the ventricles of the brain. Pressure expands the brain and skull. Latex allergy is common in this population. Oral manifestations, none directly associated. Evaluate for pre-medication if persons has a ventricular arterial shunt.